Welcome to the Business Spotlight interview today. I've got Carol Rafferty from Dentherapy, the developers of Tooth Boost. Welcome, Carol. Thanks for joining me today.
No, it's good to connect, Brenda. Thanks for inviting.
So, yeah, tell us a bit about Dentherapy and Tooth Boost then. What is it that you do?
Right. Well, I'm CEO and founder of Dentherapy, co-founder actually with another female founder. And my background's in dentistry. So I've spent a career as a dental hygienist in dental education, undergraduate, postgraduate, and also completed a master's in public health. So most of my career has actually been spent in a clinical setting with my patients. And about sort of 8 years ago, perhaps, when we first founded the company, I was, as a dental hygienist, you're basically advising patients on how to control or prevent dental disease, and you're recommending the products that they can use to achieve that, or to stabilize things, or to get into good habits, a combination of all those things. And I was just gradually kind of coming to a conclusion that the products that I was recommending rather to the patients are very sedentary, as in as good as toothpaste and mouthwash are, and I would wholly recommend you use your toothpaste twice a day, they do need a sink. And yet the point when our mouths are most vulnerable is when we've just had something to eat or something to drink or snacking. And we're all aware of tooth decay. Too much sugar causes tooth decay, but there's a real rise in a condition also known as enamel erosion, where if you're having a lot of acidic foods, rather than a disease process taking place, you have this interaction of acid in the mouth, which is basically kind of wearing away the surface of the tooth. So it's a bit like the sea coming into the shore and creating sand, as it were. And this tends to go on kind of throughout the day when we're having something to eat or drink. And the mouth's very good at actually buffering the acid and restoring a healthy environment. And so my concept was to come up with a product that would support that healthy environment, restore essential minerals to the tooth surface when they've had an acid attack or a sugar attack. But I wanted that to be a product that you could carry with you. You could pop it in your bag, you could have it in the car, you could have it on your desk. So we set about developing a product, and this is our product or prototype, and it's called Tooth Boost Oral Mist. So it's basically been designed to give your mouth a boost at points throughout the day or in the evening when you're nowhere near a sink for your toothpaste juice, but you actually do need to protect the teeth and restore a nice, healthy environment.
Fantastic. Yeah, I'm loving that. So what stage are you at with that then?
Right. Well, I'll maybe take you back slightly.
Yeah.
And just to say, as a dental hygienist, my skills were clinically engaging with my patients. I didn't know anything about formulation developing, gathering a scientific team of biochemists, formulation specialists. I didn't know anything about intellectual property. I didn't know anything about regulatory requirements for new dental products. So it was almost as if I woke up one morning and thought, I need to get to the moon. Now, how do I go about that, knowing nothing about it? So I've been very fortunate in that I have, in a friends group, had people who had a bit of knowledge in biochemistry. And slowly, through wonderful organizations like Opportunity Northeast, Life Science Division, we have fully had a lot of support and become part of the life science community. So this has actually offered a bit of knowledge, a bit of insight, and helped us on our path to get to the point where we are now. So I'm now coming back to your question here. So So we have developed the formulation with our formulation expert, and that's Dr. Richard Wilson. And Richard previously was a senior formulation specialist with GSK. So he helped develop Sensodyne and Pro-Enamel and what have you. And we are now engaged with a manufacturer, and we're looking to see if we can actually get the product manufactured and then out for sale, as in, you know, online sales or till point, or so we're entering a new phase now whereby we're continuing to develop other delivery modes for the product. So other, you know, be it toothpaste or mouthwash or things I can't talk about. And also to see if we can take our first product, which is unique. The USP is there are no on-the-go therapeutic products that you can use to kind of prevent early enamel erosion and prevent early tooth decay, or even restore the tooth surface there. And it tastes great. We've worked with a global flavor system company, and we've got a lot of engagement with consumer trials, so we know a lot about its sensory experience as well as its therapeutic functionality. Yeah.
So at the moment, pre-revenue, then you're not selling.
Yes, that's a very good point. Yes, I think, you know, with a lot of life science companies, what you'll tend to find is they'll maybe be university-based and they'll spin out with their technology, and then they start a long path towards developing a medical device or a medicine. We were kind of the opposite of that. We more or less had to spin into universities and find scientists to kind of help us develop our formulation. And I would say that this whole development phase has been way longer than we would ever have guessed or known. Yeah.
I would imagine if somebody's thinking of, you know, has had an idea like this and is thinking, so what's the time frame been? And, you know, I guess where does the money come from to go through that long process of developing, and now you've got a product?
Yeah. Yeah, we were really lucky to begin with that literally a sort of a family friend kind of worked at Edinburgh University, worked in that whole translation department, as in taking spin-out companies and going on a journey to see if this was a commercial proposition. And as I say, I kind of sat down with what I thought was a commercial proposition because I was sat beside who I perceived as the consumer and the end user, and then had to go back into the science. So my contact was able to put me in touch with Scottish Enterprise, and the company was able to get a SMART grant to begin doing the kind of initial exploratory steps as to whether we had the potential to develop a formulation and whether we had a product concept and that type of thing. We're a very small company, and we are actually self-funded outside of the occasional grants that we can pull in for the sort of scientific development up until this point. Yeah.
So I guess it's, if someone else is thinking along going on a similar journey, it's who do you know that's going to help support you in terms of the technology, the science, and the funding?
Yeah, but I would say you have to start somewhere. So
yeah.
I didn't know all the people that I've subsequently met. You just need one person, actually. You don't know the cascade of people that you will then go forward to meet. And I would say I've been blown away by how generous people are within the life science community. They really want to help, and you engage with a whole plethora of people you didn't even know existed, and people in working lots of different disciplines. But you maybe be aware that Opportunity Northeast has sort of been at the forefront of this brand new building that we've got up at Aberdeen Royal Infirmary site called the BioHub. And that's really funded by themselves and Scottish Government and the university and Aberdeen City Council. And this now literally is going to be the venue where people like myself and university spin-out companies actually come to kind of continue their journey or start their journey with a great idea in life science. But the critical point with any product and getting it to market is you have to know if there's a need for the product and identify your end users and your early adopters. And that's a whole new science in itself, I would say.
Yeah, massive learning curve if you've not been involved in that already. Yeah.
Yeah, definitely. And I think I was slightly biased to begin with because I think, well, I already know who potentially could use the product and I could see its application. But when we kind of, through Opportunity Northeast, and it was BioCity at that time, they're now called We Are Pioneer, but we did a whole kind of accelerator program where we actually had to go out and engage with people and talk about the well, actually, no, we didn't. See, I'm now falling into that trap where I'm saying we had to talk about our technology. We didn't have to talk about the technology at all. We had to go out and ask them questions about their dental health and what their current habits were and what their concerns might be and what their pains were at different stages of their lives when it came to looking after their mouths. So it was very easy to come out the door thinking you were selling them your great idea and this was your baby and of course they would love it. And you had to ignore all of that and go out and actually just listen to the consumer and then come back and see if that validated your value proposition, they referred to it. So that was hugely interesting. Absolutely.
Thinking outside the box, they call it, don't they? How often on your journey have you had to think, change the way that you think about parts of your business?
Yeah, and not only are you changing the way you're thinking, but at every turn there's a stop sign that says this ain't working. This is a problem. Oh no, what's going to happen here? And literally, you just have to go around the sign. You go over it, you go under it, you go around the side, or someone opens the sign and it's a door into the next room, and then you proceed with the project. Yeah.
I think you have to enjoy those, don't you? Those challenges, those signs. Those are the ones that are going to get you closer to the right solution, I guess.
They are, because I think when something kind of looks like something's a hurdle, you get this sort of creative thought and you're thinking, right, what do I do here? And you're kind of looking for inspiration, and that might come from yourself, but often it's chatting to someone else. It kind of then sort of, you find the key for the door, for the lock, and then you can kind of move forward. And I mean, there are real challenging elements to what we're doing here, but there's no doubt about it. It's been a blast and it's been difficult at the same time. Yeah.
So, some people that I talk to, they always wanted to have their own business. And is this something that you always wanted to do, or is it taken you by surprise?
No, I didn't ever think, I wanted to have my own business. I mean, I was involved in running a dental practice at some point in my career, but no, but I think throughout my career, I've always kind of thought to myself, what else could I do? What's next? And so I had, I'll confess, I had a pivotal birthday where I thought, what else could I do? I'm teaching, I'm working for NHS Education Scotland, I'm working as a hygienist, I've had my family and I've done my master's. Is there something else? And it's not that I had a burning ambition, excuse me, but I think I've just always kind of rolled forward, and perhaps I have looked for a new challenge. It hasn't felt like that, but I think momentum is the thing I've just kept rolling forward. And now I'm in a huge arena that I didn't expect to be in.
So what's the future going to take then? You know, what are your goals for the business and the technology?
Yeah, again, I think what's interesting about the technology combined with my role as a dental professional, it's been just, and it is just as important that we engage the dental profession in our technology. And that means beyond a lot of the in vitro, the lab work that we've done, we're now in a position where we need to go forward and do some sort of real world studies or in vivo studies so that we continue to get the supporting data for our publications, as well as engaging dental professionals, because we really want this to be a product that, you know, someone wants to use after coffee because it's great and it gets rid of coffee breath and it freshens up your mouth. And at the same time, because of its therapeutic application and because there's a real need for this in the oral care market, and that's globally, not just here in Aberdeen, Scotland, UK, then it's really important that we kind of work with the oral health professionals and engage with key opinion leaders and that help with our publication strategy. So that's sort of one element. And then the other element is actually doing the scale up from lab scale to GMP manufacture, to working to do the marketing, the product placement, and the commercialization. So they kind of run concurrent. And yeah, I want this product out there because it has applications for a wide variety of consumers and patients that need to kind of look after their oral health. And I think we're really at, use that phrase, the paradigm shift, whereby oral health previously is all about kind of looking after teeth and preserving teeth and not losing teeth early. Whereas now oral health is very much kind of connected to what's known as your systemic health or your metabolic health as well. So having a formulation that kind of supports healthy oral microbiome and maybe and inhibits oral plaque, as it were, has the potential to create a really healthy environment in your mouth. And that's important to also support cardiovascular health and prevent diabetes and Alzheimer's. So there's just a whole new shift now in the importance when it comes to looking after your mouth. Yeah.
And do you know, it's a business. You've got something there that a lot of people are gonna want to use, and it's got a global
reach
market there. Yeah, you're going to make money with this.
We absolutely need to make money because we've been spending money thus far. Yeah, we definitely have to bring income in as a company, and we have not lost focus on that. You know, again, you know, COVID kind of segued in, and you know, and that kind of, we were lucky that none of our scientists went down with you know, with the virus to the point that interrupted any of our development work, but certainly engaging people and on the commercial side. Yeah, so we've had a few different pathways, but this is definitely where we are now.
And how big's your team? How many people involved at the moment?
Yeah, we're a really small team, but with a lot of people that can kind of help and offer their time. That again goes back to it being sort of, you know, just people being very generous. And so there's myself, and there's Catherine, and so I'm CEO. She's my fellow director and founder, and then Graham, who's our chairman, and then we've got our chief scientific officer and another scientific officer, and then we've kind of got a non-executive director involved in the company. And then we kind of work with consultants and with people that are willing to give their time to kind of help us at whatever stage of the journey we're at. But everything we have done to date has been from my kitchen table, literally. So before anybody else was having to sit and work at their kitchen table, that's exactly what I've been doing. And so it's almost been like a virtual team.
Yeah.
Because our scientists based in Plymouth and others based in Edinburgh. So yeah, that's kind of the size of the company.
Who do you need next? What's the next support you're going to need to move it forward?
Next support is absolutely going to be in the whole kind of marketing, sales, product positioning. We're kind of working on branding and things just now. So yeah, that's kind of who we're now amassing and collecting. And we've been incredibly fortunate that we have come across people who have been in the industry, with vice president kind of roles that are now out and consulting. So we now have people that have gone through supply chain with global companies, oral care companies. And actually, all of this is just that one person who says, oh, get in touch with this person. LinkedIn is great, actually. And it wasn't something that I fully engaged with probably till fairly recently. I was never a Facebook person, so it was quite strange for me to use LinkedIn and share bits and pieces. But yeah, that's, and again, because of our dental profession, we go along to conferences. So we've just come back from the British Dental research conference, and we presented a poster and were able to introduce ToothBoost to the community there. Yeah.
Oh, it sounds like such an exciting time that you've had and that you've got going forward. I mean, manufactured and ready to get on someone's shelves is very exciting.
It is. And within kind of life science and you should kind of maybe kind of step forward for funding. It can be very challenging as females in many organizations, but certainly within life science, to kind of secure the funding. And a lot of the panels are sort of made up of men predominantly, but there are sort of female funders and angel investors kind of coming in to fully support females. It is gradually,
yeah. I mean, you're probably aware that only 1 in 3 entrepreneurs in the UK is female, and men are 5 times more likely to scale their business up than women are. So good on you and Catherine. I think I'll be following your journey closely.
Happy to keep in touch.
That's been fantastic. Thank you so much, Carol, for being on the Business Spotlight today. I've really enjoyed it.
It's a first for me. You're my first podcast here, so there you go.